Welcome back to the Health Longevity Secrets Show with Dr. Robert Lufkin. 1 out of 4 people have a disease globally, which is now the leading cause for liver transplants and is driven by our dietary choices. Today, we are joined by Dr. Mikael Forsgren, lead scientist at AMRA Medical, who will discuss his work using magnetic resonance imaging for body composition to better understand this disease. Mikael received his PhD at Linköping University's Center for Medical Image Science and Visualization. Before we begin, I would like to mention that this show is separate from my teaching and research roles at the medical school with which I am currently associated. It is part of my continuing effort to bring quality, evidence-based information about health and longevity to the general public. Now, please enjoy this interview with Dr. Mikael Forsgren. Hi, Mikael. Welcome to the show.
Hi, Robert. Thanks. Thank you for having me.
Today, we get to take a dive into the use of magnetic resonance imaging to do body composition analysis, as well as looking at things like liver fat, and then also understand some of the diseases that this technology is being applied to, and also how we can use it to manage our own health and wellness in the lifestyle choices we take. But before we do that, let's take a moment, Mikael, and tell us a little bit about how you came to be so interested in this fascinating area.
So I guess it started more than 10 years ago when one of the founders of the company I work for now grabbed me as part of a bachelor project and threw me in front of an MRI scanner and asked me to assess and fix some issue they had with assessing the liver. And then I continued on that technology side of MRI and started exploring and working on a bunch of different MR-based methods trying to replace a liver biopsy. And eventually I started to read more and more about the clinical aspects of all of these things, and working together with physicians on these various research projects. I'm now almost fully transitioning into the clinical applications rather than focusing on the technology side. So now I'm just trying to apply these skills that I have in MRI and trying to solve real world problems.
Great, great. Well, let's take a moment and talk about some of the diseases that before we talk about the technology, let's talk about the diseases and see which diseases this technology can address. In particular, there is a disease that's an epidemic that's sweeping the world. It has a prevalence of about 25% and maybe even higher. And I'm not talking about COVID, actually. I'm talking to something that may be even more significant in the long term. And it's largely attributable to the epidemics of obesity and metabolic syndrome. And in the United States, this disease has become the #1 cause for liver transplants in some situations. So maybe you could speak to this and tell us a little bit about this disease.
Yeah, so the disease that probably not that many people have heard of is non-alcoholic fatty liver disease, or fatty liver disease for short for some people. So it's tightly connected with obesity, and as obesity is increasing, the prevalence of fatty liver disease also increases. So it's tightly associated with metabolic syndrome and diabetes. So actually, if you have non-alcoholic fatty liver disease, you're more likely to have diabetes, or type 2 diabetes, if you want to be more precise. And vice versa, if you have type 2 diabetes, you're more likely to develop fatty liver disease.
Let me take a moment and amplify that just a second. This disease is called non-alcoholic fatty liver disease, and that's sort of a strange name, having alcohol in there. But I remember when I went to medical school and practicing up until about 1980, the main cause of fatty liver disease was alcoholism and drinking alcohol. And then in the 1980s, with the introduction of high fructose corn syrup, we began to see something different, which was a non-alcoholic version of that. And that's what we're talking about now. And this non-alcoholic version of fatty liver disease has surpassed the alcoholic version and has now become by far the most common cause of fatty liver disease. Great.
Yeah, exactly. And it's also expected to be a leading cause for liver transplantation. It's not there yet, but since the disease is increasing and thankfully we've been managed to cure hepatitis C, it's probably to be one of the most prominent causes of liver transplant in the future. Luckily, it's a fairly slowly progressing disease, and not everyone will progress to the end stages, but yeah, it's on range of 20-30%. So it's a huge number of people who actually are suffering from it or have it.
And what this is a deposition of fat in the liver, is that right? Right, it's called fatty liver disease, is that right?
Yeah, exactly. It's typically defined by having excessive amounts of fat in the liver, and that's sort of usually seen as a benign phase, and then you go into something called NASH, which is steatohepatitis. So you have an ongoing inflammation also within the liver, coupled with cell death and scar tissue formation. And that's sort of the more damaging phase of the disease, which can eventually progress further into something called cirrhosis, where you have excessive amounts of scar tissue throughout the liver. And eventually you would need a liver transplant to cure that, because the liver is more or less replaced by scar tissue to a very, very large extent at that point.
So how is non-alcoholic fatty liver disease linked to obesity or metabolic syndrome? What is the relationship to that?
So it all connects to, I mean, it's probably the same different manifestations of the disease in different organs. So I think it's challenging just to focus on the liver. You need to look, have a holistic view and see the entire body. As I mean, the liver drives metabolism to a large extent throughout the body. So the body is affected to a large extent by the liver. And then you also have a crosstalk between the muscles and the liver. And that crosstalk itself is also further influenced by obesity, inactivity, and excessive amounts of fat. So there's a lot of different players in the body that interacts to influence this disease and its progression. And there's still a large number of unknowns in how this disease progresses and how to cure it. So it's a huge amount of effort going into finding cures and treatments for this disease.
And there's certainly genetic components and environmental components. Is this similar to the foie gras, that when animals are induced to have very fatty livers as a something to consume? Is that a similar type of phenomena, or is that a different mechanism?
It's a good question. I think my gut feeling would be yes, that's similar, that you have an excessive amount of food intake and very, very little activities. You have too much energy going in, and the liver is very good at storing energy. That's what it's doing in the short term. So I think it's a good analogy.
I've heard people, if you want to make foie gras, you feed the duck or the goose basically a corn slurry, and that's been known for hundreds of years. And the corn slurry, of course, is high in fructose, which is what the liver converts to fat. And not surprisingly, high fructose corn syrup has begun to dominate our diet since the 1980s, when non-alcoholic fatty liver disease suddenly appeared on the scene. So many people suspect a link there, but like you say, it's complicated, and the etiology and risk factors are still being worked out on this. How does, you mentioned the fatty liver disease also the manifestation of the overall metabolic syndrome involves other parts of the body, such as overall total body composition, and we hear the term sarcopenia. What is that?
So if we start in the more early stage of disease, we have done some research that was published some time ago on general population. We looked at people with high levels of liver fat and low alcohol consumption, so a definition of non-alcoholic fatty liver disease. And we could see that by looking into the skewness in body composition, say that if they have high amounts of abdominal fat, that is visceral fat, or the bad fat, if you will, that's sort of within all your intestines and your organs, coupled with high muscle fat infiltration, that's sort of associated with having a metabolic disease. And then if you couple that with either high or low liver fat, we saw in that same research that if you have high amounts of liver fat, you're more likely to have type 2 diabetes. But if you have actually high visceral fat and high muscle fat with low liver fat, that was more coupled to having coronary heart disease. So it's interesting to start to look into the skewness and how these different ectopic fat compartments interact together to really see how various metabolic comorbidities come into play into the fatty liver disease spectrum. And that sort of the more earlier stages of the disease. Now going into the sarcopenic area. So when you come towards the end stages of the disease, the livers can't really successfully maintain a working metabolism in your body. So you actually starve ever so little when you sleep in between the meals, which then makes the muscle take a hit that they themselves need to produce energy by breaking down. So in that aspect, you have a slow decrease in muscle mass, coupled with also with the increased muscle fat infiltration due to the disease. You have two things affecting the muscles: slower muscles and increased muscle fat. And actually, if you look into those with end-stage liver disease, that is those who had come to cirrhosis and would then need potentially a liver transplant, depending on the definition, but almost up to 70% of those have some stage of sarcopenia. So it's highly prevalent when it comes to those end stages, that you have a severely depleted or worse muscle composition.
So what is the definition of sarcopenia? Is it decreased muscle mass below a certain criteria?
So there are a few different definitions there. There's not really a strong consensus. It's exactly how to define it, but most would say that it's a combination of loss of muscle mass and function, and then you can measure that by various ways. So I think that's everyone would agree that it's a combination of that muscle mass loss and functional depletion.
Okay, yeah. And before we leave the liver and get into the muscles, I just want to interject one last thing. There's, and we'll put this in the show notes, there's a great, some interesting work done by Robert Lustig, looking at liver metabolizing alcohol versus liver metabolizing fructose. And it has many of the same overlapping pathways and many of the same damages as resulting in fatty liver with both of them. And he's quoted as saying that fructose is like consuming fructose is like consuming alcohol as far as the liver is concerned. It's like alcohol without the buzz, sort of, or without the intracranial effects necessarily. Although with young children, I think we both know that consuming fructose can have a buzz too, as far as the sugar rush with them as well. But let's look at sarcopenia and body composition. What are some of the approaches before we get into the magnetic resonance imaging? What are the alternative approaches for body composition? What are some of their limitations?
So there are a few different ways of assessing body composition, but it also depends on what you want to measure and what level of detail you need that. So there is, of course, magnetic resonance imaging that we'll touch upon later, but you also have something called DEXA, which is a extension of a modality that's actually used to measure bone density, but can also to some extent assess the amount of lean tissue in your body. So you can see that. The limitation there is you can't really differentiate, can't really dig into seeing if there's fat infiltration in the muscles or see which compartment you have fat in, because you just see straight through a body. So everything is sort of packed together there. Then you can also use CT, so CAT scan. Typically don't do whole body scans due to the radiation, but you can do like single slices, and can pretty much do similar quantification as you can use with MRI. But with MRI, you can do a whole body instead. Other way about body composition, I guess, is also bioimpedance scales, where you stand on a weight and then you have an electric current going through your body at different phases, and then you measure how the signal is affected by traveling through the body. And then based on that data, you then go into a lookup table and see how the body likely is composed based on that. So on a general level, you can have some merits there. The problem there is that it's affected by, if you have, for instance, ascites or edema, which have in towards the end stages of diseases, and a bunch of other things. And also, since it's a you estimate body composition based on that signal, so it's not a direct measurement. So, but it all depends on what level of detail you need for your application in the end.
Yeah. So a scale basically that we've all used would just tell us our weight, and then we might, compare our height with it and get some sort of index there, but it's very crude and doesn't localize at all. Next, we'd have DEXA or bioimpedance type measurements, which could give us a sense of fat and a sense of the body compositions, but it's not localized into three-dimensional space, and the quantification is really limited. So the highest level then we have where we want 3D anatomy, and it actually can measure muscle volume and fat volume and differentiate between body fat and visceral fat, subcutaneous fat and visceral fat. That would be an imaging test. And really the only two imaging tests available are CT, computed tomography, and that, as you said, of course, uses radiation. So we don't want to do that for a test that we're going to apply many times, or even that we expose the whole body to necessarily, especially when something like magnetic resonance imaging is available that can basically do everything that CT can as far as body composition, and there's no radiation penalty at all with magnetic resonance. You can get it done really pretty much as often as you want. And that's the approach you've taken, right, with the company you're working with magnetic resonance imaging for body composition. So how does that work, and what are the advantages you found?
So yeah, it's also a good, interesting way getting multiple MRI scans. When you do your PhD as an MR physicist, you typically go into the scanner all over the time for your colleagues. So I guess all who has a PhD in MR physics have spent days in a scanner, and I haven't seen any publication that no one has suffered from that. So, but yeah, it's a very, very safe modality indeed. So what we do at the company, so it's actually a spin-off company from research. So a bunch of researchers at the University of Linköping who started this company almost 10 years ago. It was actually inspired by Spurlock's Super Size Me documentary, which came around that time. They did a study and wanted to see if they could quantify the body composition efficiently, because in the old days, you pretty much had to go slice by slice and quantify. And they wanted to develop a more automatic way of doing that. So pretty much what you do is have a fairly brief MRI imaging session, takes about 8 minutes, going from neck to the knees. And then that's it in terms of put it at the hospital, and then it's all algorithms then doing a quantification based on those images.
So just quick reference, we will link to Morgan Spurlock's seminal documentary, Super Size Me, where, what was it? He went to a fast food restaurant, I think it was McDonald's, for a month and survived barely on McDonald's only food. And I think he saw his metabolic parameters. He had frequent blood tests and all decreased over that time. But we'll link to that as well. So I just wanted to put that in there and continue then. So
yeah,
now,
so actually that study that was they did was actually they took like 15 medical students and gave them similar treatment as Spurlock. But then we did also MRI, because that back in those days we didn't have that technology. So that study then made them develop the technology to do this whole body MRI assessment. So that was only them focusing on the liver in terms of fat infiltration, etc.
now you mentioned that to do this body composition with magnetic resonance imaging, you scan from the neck down to the knees. Why were maybe tell our audience why those choices were made? Why wouldn't you scan from the top of the head to the toes?
Because you don't have that much fat in your head. Well, you have some fat, but it's mostly around your neurons in your brain, and not that many things that happen up there. So we wanted to focus on the central pieces of the body, and it's always like it's you have to decide how quickly you want to have it done and how easy that it is to get it moving on other systems and have it sort of being scalable. So this was one way you're doing it very, very efficiently and rapidly and in a standardized manner. And also, since you don't have big fatty deposits or muscles in your head, that's because since we don't want to do it quickly, we can't have very, very high resolution. So it's difficult to find these small muscles in your head doing this rapid acquisition that takes just 8 minutes. Of course, you can use the same technology going into small muscles, which we typically do in like neuromuscular disorders, but that's a whole different type of sequence, which takes much longer time, and it's more for a specialists like clinical trials, etc.
Yeah, so the key areas really would be the abdomen for your visceral fat and subcutaneous fat, and of course the key structure of the liver. And then by extending down to your thighs, you get large muscle masses, and presumably, what's happening in your thighs is happening in your calves. So it's not really necessary to do the calves, and the brain, like you say, it doesn't add anything. So you're really hitting the high impact areas with this study. And what have you found? What are some of the results you found with this technology?
So as I mentioned a little bit earlier, we could see that when we look into the sort of the skewness of body composition, if you will, so looking into how these different compartments are against each other, we could see that if you have high amounts of visceral fat with high amounts of muscle fat, that was linked to having metabolic disease. And in the same research also saw that if you have either high or low liver fat, you have more likely type 2 diabetes or coronary heart disease. So that was published back in 2018, 2019. It's actually picked up by National Geographic, who made a special edition in 2019 on the future of medicine, where they worked further on that case. And actually, they coined the phrase, "It's not the fat, it's where it's at," which is quite a good one just to describe that, because you can actually have the same BMI. That is shown that research. You have the same BMI, but different risks for metabolic comorbidities, pending your skewness in your body composition or your ectopic fat compartments.
Yeah, that's a key point that bears repeating, I think. Yeah, for a given weight, depending on how the fat is distributed into various body compartments, which is what the body composition MRI can show. For the same weight, you can have two people, and one is very healthy metabolically and one is very unhealthy metabolically, and you wouldn't be able to tell from looking at them or from their weight as measured by a bathroom scale. And along the same lines, I think it's worth repeating too that metabolic health and all of these problems with the liver and wellness, it's not just a problem of patients with obesity. In other words, in fact, as we've talked about on other episodes, you can have people who are clinically obese, but they're metabolically healthy. And you can have people who are thin, but are very metabolically unhealthy, with all the risk factors and all the increased incidence of diseases and life expectancy associated with it. So it's not enough, unfortunately, just to say, well, I don't have a problem with my weight, I don't have a problem with metabolic disease. And of course, in the paper a few years ago that everyone quotes, over 80% of Americans have metabolic disease as defined by at least one of the 5 criteria for metabolic syndrome. So this is truly a pandemic. But this body composition analysis will allow us to zero in on which patients have metabolic abnormalities there. How long does the scan take? What is the experience for a patient when they come in for one of these studies?
So it depends if you're appending this to an already prescribed MRI scan. For other reasons, then it only adds about 6 to 8 minutes roughly. But if you're doing the scan only for this analysis, then you have to add also the time of getting into the scanner in and out. So, but you could easily do it if within 20 or 30 minutes if you're doing only an examination for this. Having someone going into the scanner room, going into the scanner, have the images, and then go out. So it's very efficient, and there's no contrast enhancement or any things you have to put on the body. It's just into the scanner and take the images, and then you're done. So it's very, very quick in that aspect.
So it's scanned with the body coil then, pretty much. And
correct.
And
it just uses the built-in.
And also, as you said, no contrast injections. So none of those intravenous injections that sometimes we add for magnetic resonance scans, but in this case, not doing that at all. And where's the scan available currently? We have a international audience to this program, so what countries is it available in now, and how do people would go about requesting one of these scans?
So currently, our scan is actually supported by at least 80% of the MRI scanners available from the major manufacturers. So it's a very, very good footprint in that aspect. In terms of the medical device for health and wellness, we have one medical device available in the European Union with the CE mark. And now we're working on an updated one, which we expect to get clearance in the US by the first quarter of next year. The same goes for EU, getting this new device cleared. We actually just got the clearance from Canada for that same device. So things are moving to get this available to people. So far, we've been involved quite heavily in major multi-center clinical trials with the same technology, which are now bringing to the health and wellness area.
Yes, we're hoping to have one of these available in the Los Angeles area where I'm based in Q1 2022. What about the clinical trials? What are some of the clinical questions that you're finding this technology useful to address?
So in some scenarios, they have been used to pretty much try to see, so do we have any unforeseen effects somewhere in your body? Can we look into that? Or can we see any other good impact One of the very, very good examples is in our neuromuscular disorder studies that we've done that recently came out with Fulcrum Therapeutics for one of those rare diseases. And we were showing very, very good results with our technology. So it's you can apply it to a bunch of different diseases and different aspects of the disease, since it ultimately it describes the manifestation of the disease on your body. So depends on the mode of action of the treatment and which questions you want to answer. So it can be used to do quite a lot, which also makes it kind of hard when you're just talking about it, because sort of like a blue ocean thing.
Yeah, so many applications. Well, for our audience interested in health, longevity, and in particular the lifestyle choices that we can make to influence those things, this could be a very powerful technology. And anytime we evaluate a new test or a tool to apply in this area, the first question we always ask is, can the lifestyle changes that we make, choices that we make, and the changes that result be seen by this test? And I would say, of course, people routinely change their body fat, their overall weight, but also their body composition and arrangement of fat, decreasing visceral fat and versus subcutaneous fat can be done with a number of the interventions that our audience has been looking at. Have you seen that as well?
Yeah, we see changes in a number of different compartments. Often you can see changes in, for instance, in liver fat, because it's a hot topic since everyone's trying to really solve the fatty liver disease issue. But since that's coupled then with the entire metabolism, you see also changes in other compartments, such as the visceral fat compartment. And since we can do it to very, very high precision accuracy, you can find very, very small changes, which are actual changes that you can measure over time.
Yeah, it's been a revolution to me, or to my understanding, since I've gotten involved with lifestyle choices, and into just how much of a dramatic impact simple lifestyle choices like diet or exercise can have on our entire body. I mean, not only liver fat, people can lower their liver fat and reduce their fatty liver disease, or lose weight or change their body composition from a metabolically unhealthy form to a metabolically healthy form just by lifestyle things, avoiding certain foods and even brain volumes. I was blown away to see hippocampal volumes in the brain on MRI, when it's lost as a biomarker for Alzheimer's disease, can be increased over a period of months, and it can be seen dramatically on the imaging. So it's amazing the effects that the lifestyle can have on these quantitative measurements. But it's also, on the other side of the coin, it's very powerful having a technique like body composition, where you can quantify something, apply the lifestyle, and then a few months later retest it. It's a very strong motivational factor for the patients when they can see their liver getting healthier, or their visceral fat decreasing, or their hippocampus growing back and increasing in their brain back to a normal size. It's really very, very remarkable. So if patients want this for wellness, they can request it themselves through their local imaging center and get in touch with those. And then obviously, if it's done for a medical indication, then their healthcare provider, their physician, would request it or order it from, again, the hospital or local imaging center. Is that correct?
Yeah. So currently, it will probably be out of pocket for the patient or the person who is interested in seeing that at this point in time. But there will be other options available at a later stage.
What are you familiar with the price range, just the ballpark on, and I know I'm sure it varies greatly around the world, but
No, I'm mostly focusing on the science things
okay.
and all of that. So I'm not sure exactly what the end customer price is, to be honest.
We'll try and get some numbers if we can and put them in the show notes to update that. So with your expertise in body fat composition and liver fat and NAFLD and MRI, how has this knowledge informed your personal choices about lifestyle? In other words, knowing what you know, what do you do for exercise or diet, or any particular choices there, or sleep or anything like that?
So I actually did a analysis with this technology almost a year ago, slightly more, and found actually I had very, very high levels of visceral fat, which I did not expect. So that did not really match what you would see looking into the other traditional measures like waist circumference, weight, or whatnot. So I actually had very, very high levels of visceral fat, which made me quite startled. And then starting looking into the other parameters, saw that, yeah, but my muscle fat was very, very low, so it was good. Liver fat, really, really low, so that was fine. High levels of muscle volume, which I expected since I do exercise quite a lot. So, but the visceral adipose tissue was actually quite high, and so that really triggered me into doing some changes. But just as trying to get seeing that you need a holistic view on the body composition, also you need a holistic view on your life composition, if you will, to really get a working effect. So
Why is the visceral fat so dangerous as compared to subcutaneous fat?
So you can hardly find any links for subcutaneous fat for disease, other than if you lose quite a lot of subcutaneous fat, then you're likely cachexic and are about to have a very, very severe end stage event. But visceral fat is coupled with quite a lot of risk for developing disease. But as I looked then into our database with individuals with having the same combination with high visceral fat but low muscle fat and low liver fat, the propensity for having diabetes, coronary heart disease was just a few percent. So that really made me feel, okay, got it. This is nothing to be alarmed by now, but I better get that value down before anything happens. So that's the beauty here. You can really start to see things that you can actually attack before they become a actual disease. So 9 months later, I was down 10 kilos, and I've maintained that since by just not that drastic changes, actually. We've skipped all of the highly processed foods and all of those sugaries, because those are big no-nos. And then also just going, so every morning is always oatmeal and whole grain and sourdough breads, and going back to the old cultural wheat varieties like emmer and spelt. So, and then portion control, smaller plates, eat less food, and small changes like that can still be sort of sustainable changes. So you can't, because I figure it's kind of hard to do big drastic changes, because that will be hard to maintain in the long run. So we were starting just doing small changes that we can maintain, and then sort of have a snowball effect, adding more and more stuff, because it was not a critical event, but we wanted to have a working solution to get it down.
Yeah, that's been very powerful with people, rather than going on a quote diet that, you know, people will stay on for a matter of days or weeks and then end the diet. Rather than that, make a gradual change that we don't really think of as a diet, but just it's the way we eat, whatever we eat, and that becomes the normal for us, and that is sustainable by definition in the long term. So that's great. Any do you do any intermittent fasting with that?
I actually tried that prior to doing all of that. So I actually tried it during my PhD years for a few months, but during those 2 days of calorie restriction, I really couldn't be sharp mentally. So it had too much of an impairment on my as other aspects of life. So I did not continue that. But it was an interesting experience to try out. So, but for me, it was challenging. But so seen for others, it's been working. So this is also, everyone is slightly different. So different things work for different people.
Yeah, it shows the importance of whether it's diet or supplements or fasting. These lifestyle choices all have to be personalized because the effects are so different. Any supplements or devices that you use to follow your health?
Well, I actually use the traditional scale. So I have almost 10 years worth of data to track back and see the impact of your big holiday events with binge eating and then all these other, but it also goes to show, I mean, looking at the scales, I would sort of, yeah, slightly above where I should be, but probably not that bad. But then when you did that BCP scan, seeing the exact values of the visceral fat, is like, whoa. So I still now have a cut point that I don't want to move over in terms of weight. But again, it shows that you need more data there. But other than that, of course, as I have a smartphone, you have a step counter built into that one, which I try to look at now and again. And really, if there's too much of a hard, intense work periods where I've not moved enough to really step up. And but the good thing is I have a 2-year-old son who really loves biking. So once or twice a day, he's up on the back of my bike and we go for a ride for half an hour, 40 minutes. It's a good solid exercise. And also having a small son, which is quite active, it's a good exercise by itself.
Absolutely, absolutely. Well, Mikael, tell us, how can people follow the work you're doing? Is there a website they should go to or social media?
Yeah, so actually I have a few colleagues who also do this type of work with these measurements. So I think that the company's LinkedIn page, AMRA Medical LinkedIn page, really highlights all of our research that we do. And of course, on my personal LinkedIn page also highlight the research I'm directly involved in. But so following both, you get both specifically to me and then all the other things that my colleagues work on. So we're a team of clinical scientists at AMRA that are all involved in different aspects of trying to really dig into how body composition really relates to disease and outcomes.
Great. Well, and we'll link to all those in the show notes as well. Well, thank you so much, Mikael, for spending this hour with us and sharing the fascinating work that you're doing.
Thank you.
Yes, and look forward to, let's stay in touch, and I want to hear about all the great things in the future that we have to look forward to as well.
Looking forward to it.
Note, this is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking of it because of something you have seen here. If you find this to be of value of you, please hit that like button and subscribe to support the work we do on this channel. Also, we take your suggestions and advice very seriously. Please let us know what you'd like to see on this channel. Thanks for watching, and we'll hope to see you next time.